Hello, hello. My name is Jones, and today we are looking at pharmacology. So, we are looking at introduction to pharmacology. We are going to look at the basic concepts of pharmacology. To start with, let's define the term pharmacology. So, by definition, pharmacology is the study of substances that interact with a living system through chemical process, especially by binding to regulatory molecules and activating or inhibiting the normal body process. So in pharmacology, we study chemical substances, which are drugs. Okay, so these chemical substances, we study them and look at how they interact with the body or the living system. So it is through understanding of these chemical process, how they bind with the molecules within the body, and how they activate or inhibit certain things within our living system is what we call pharmacology. So pharmacology, we are necessarily looking at it as the study of substances that interact with the living systems. Okay, so now how they interact is by binding to regulatory molecules, activate or inhibit. They either enhance or reduce, depending on the illness that is at hand. So they may be used to activate. But for this part to be done, these the drugs they have to interact with the regulatory molecules within our body. Okay, so in a nutshell, we're looking at pharmacology as a study of drugs and their interaction with the living system of the body, and we have amplified. Now, let us look at the branches of pharmacology. So, when looking at branches of pharmacology, we have pharmacokinetics and pharmacodynamics. So when I say pharmacokinetics, pharmaco from the term pharmacology, kinetic to do with movement, we are saying this is the study of effects of the body on the drug, or we are saying this is the study of effect the body has on the drug. So when we are looking at pharmacokinetics, we are looking at ADME. Okay, so when I say we're looking at ADME or ADME, we are saying we are looking at absorption, distribution, metabolism, and excretion of the drug. So in pharmacokinetics, we are necessarily looking at the effect that the body has on the drug. The opposite can be true when we are defining pharmacodynamics. In pharmacodynamics, we are looking at the effect of the drug on the body. Okay, so that is what we call pharmacodynamics. The effect of the drug on the body. Does it cause you to be drowsy? Okay, so we are looking at such things. So that is what we call pharmacodynamics. Okay, so now let us expand more on pharmacokinetics and pharmacodynamics by first elaborating more on pharmacokinetics. So before pharmacokinetics, it is important to understand about the routes of drug administration. Before we understand the effect of the body on the drug, we need to appreciate the routes, the routes or the routes, okay, of the drug, as drugs can be given different through different routes. Okay, so the routes of drug administration may include the following. Okay, so the route of drug administration also determine how fast the drug will be used within the body. Okay, so the route of the drug determine how fast, how effective, how available, easily available the drug will be. So the process of drug, that is water or lipid solubility or ionization, it goes with the route of the drug administration. When you talk of the therapeutic objective, that is the desirability of rapid onset of action, okay, so that is, or the need for long-term administration depends on the route of the drug. So this suffices to say that when you give the drug within the vein, within the blood, we're expecting that drug to act faster because it is being made available within the blood where you can find the infection or where you can easily find the receptors. So then when you give through the mouth, it will have to pass through other phases before it is made available to the blood. So the drug that you're administering direct in the blood is going to be available to the body faster than the one that you're giving in the mouth, okay, or through the mouth. So there are three major routes of drug administration. We talk of one, enteral. Okay, so when talking about enteral, we are necessarily looking at oral or sublingual. Enteral, you're looking at the oral or the GIT, that is oral or sublingual. Oral by mouth, sublingual under the tongue, sub under lingo to do with the tongue, so sublingual. Then there is parenteral. When you talk of parenteral, you are giving either by intravenous fusion, okay, abbreviated as IV, or you are giving through intramuscular, abbreviated as IM, or you are giving through the skin, okay, so which we can say subcutaneous. Okay, then other routes or routes of drug administration includes inhalation. Okay, so you can give through inhalation where someone breathes on the drug. Okay, the drug has been vaporized, then you breathe it, you breathe the drug in, like someone with a status asthmaticus, so the administration of oxygen, so you can inhale. Okay, so there are drugs that can be given through the intranasal route, others are given topically, more like the one which you apply on the skin. So that is a topical route of the drug. Okay, so now when we talk about Entero as a route of administration, okay, it is the simplest and most common means of administration of drug. Okay, so enteral routes, they include oral and sublingual. Okay, so when we talk of the oral routes, you are giving drug by mouth, and this is called oral routes. Let us now appreciate the advantages of using the oral route for drug administration. What are the advantages and what are the disadvantages? So, some of the advantages of giving the drug through the oral route include it is the most convenient and most acceptable. The other reason is that it is used for local as well as systemic action of the drug. It can be used for local infection that may be within the mouth or for infection that might be affecting any other part of the body. So that's what we are saying, systemic action of the drug. So it is the most convenient and the most acceptable. That is the first advantage. Then the second advantage, it can be used either for local or systemic action of drug. Okay, the third advantage is that the dosage forms do not require sterile techniques for administration. Okay, and when you talk of intravenous, you require some kind of sterility to observe. Okay, it requires a lot of sterility to observe. Okay, but I'll still come to talk about the intravenous drugs and the intramuscular drugs. So here there is lesser sterility, or when you're talking in nursing terms, it's not a sterile procedure when you are giving oral drugs. So the dosage form do not require sterile technique for administration. Okay, so maybe let me give the last advantage under the oral route is that the delivery of the drug into circulation is slow, so that rapid high blood concentration are avoided and adverse effects are less. So there is a slow release of the drug into the blood system when someone takes the drug through the oral route. So the issue of having rapid toxicity is less likely when you're using the oral route. Okay, so the drug is slowly released into the blood, it's slowly released. So it is very easy to counteract toxicity when you're using the oral route. Okay, as compared maybe to the intravenous, where the drug just goes directly to the blood and other organs can easily be damaged. So we are saying the delivery of the drug into circulation is slow. This is to an advantage because there will be no rapid concentration of the drug into the blood when there are adverse effects. Now let us look at the disadvantages of oral route of drug administration. The disadvantages include one, rate of absorption is variable. For all oral drugs, the rate of drug concentration in the blood or absorption of the drug into the blood or distribution of the drug into the blood, it is different depending on how that drug has been made. Because when you're talking of oral drugs, others they have been made into capsule, others they come coated, others they come just mere tablets. Okay, so now this also it is affecting the rate of absorption of the drug. So the rate of absorption of oral route drug is tends to vary. Okay, so absorption is variable. The second disadvantage is that there can be irritation of the mucosal surface. Mucosal surface, we mean the lining within the GIT. It may cause irritation within the mucosal surface. The third disadvantage could be extensive hepatitis metabolism or extensive hepatic metabolism. So there is what we call the first pass effect. This is what is bringing about the extensive hepatic metabolism. So may occur before the drug reaches its site of action. So the liver needs to be involved in metabolizing this drug before it is made to available in the blood. So the liver might remove it from the system as a toxin. So now, if it removes it, the components that we want to be available in the blood in order to bring about therapy may also be destroyed. So we're looking at extensive hepatic metabolism that may affect the amount of drug that is supposed to be available within the blood. When we're talking of bioavailability of the drug, looking at the availability of the drug in the blood in order to give us the necessary therapy that we need. So then the fourth disadvantage has to do with onset of action is delayed, thus unsuitable in emergency situations. When you're giving drugs through the oral route, we said that the release of the drug into the blood is variable and it is slow. So the concentration in the blood cannot be high at one time or within a short period of time. But in an emergency, it becomes very difficult because you need the higher concentration in order to reverse, let's say, poisoning or toxicity of another drug. So in an emergency, it becomes difficult to use drugs that can be given through the oral route. Okay, then maybe the fifth disadvantage is that drugs can be destroyed by digestive enzymes like insulin, pituitary hormones, or by gastric acid. For instance, when you talk of benzyl penicillin, this one it can be destroyed by digestive enzymes. Okay, so it cannot be administered through the oral route. Okay, so now we have talked about the advantages and the disadvantages of the oral route of drug administration. Let us now shift our concentration to now look at another administration type of the drug within the GIT, which is sublingual. Okay, so sublingual, This is placement of a drug under the tongue and is called sublingual. It allows the drug to diffuse or to diffuse into the capillary network and therefore to enter the systemic circulation directly. Okay, so there are some drugs that can be given just under the tongue. So we are saying it can be given sublingually. Okay, that is under the tongue. There are advantages to giving the drugs sublingual. Some of the advantages that we can talk of, I'll just talk about four, is rapid absorption and the effect of the drug will be felt within a short period of time. So there can be rapid absorption and effect. For instance, glycine trinitates in angina, you need rapid absorption in order to stop the pain that is coming from the heart. So glycine trinitate in angina, we give it by sublingual route. Then we talk about spitting out tablets. Okay, so we are talking about the advantages of sublingual. So the other thing is that spitting out tablets can terminate the effect. In case of adverse reaction, when you're giving sublingual, okay, this is a drug which is just remains within the mouth under the tongue. The patient can easily spit it out, okay, in case they have adverse effect. So spitting out of the tablets can terminate adverse effect. Then low incidence of infection. As you are giving the drug by sublingual, there are low instances that other infections may set in because you are giving it by sublingual. Then there can be avoidance of first pass metabolism because now the liver will not be involved, the drug is just entering in the blood. So there's no hepatic metabolism that will be needed as the drug is easily made available to the blood vessels that are surrounding the tongue, just underneath. Okay, so you would have avoided what we call the first pass metabolism, which is to do with the involvement of the liver in metabolizing the drug so that it is available in the blood. Okay, so now with that discussed, let us now look at the disadvantages of giving the drug using sublingual route. Okay, it may be inconvenient or it may not be comfortable for the patient if you use it frequently. The disadvantage is that it may be inconvenient or not comfortable to the patient if you use it frequently. The other reason can be irritation of the oral mucosa, okay, and may lead to excessive salivation. Okay, and may lead to excessive salivation because of its presence within the mouth. All right, so we have been looking at administration of the drug using the oral route. Okay, so we have talked about using the sublingual route. We have talked about using the oral route. Collectively, this we say by Entero. Okay, so what is it? Using the Entero. So Entero administration is the simplest and most common means of administration of the drug, okay, through the GIT. So enteral routes includes oral and sublingual, okay. There are three major routes of drug administration. There is enteral, parenteral, and others include inhalation, and we have intranasal and topical. So in our next lesson, we'll look at parenteral or IVIM and subcut administration of drug. So in this lesson, we are trying to appreciate the definition of pharmacology, in which we say it is the study of medicines or drugs. Okay, so these drugs, we have said we are looking at substances, okay, that may interact with the living system okay, and bind to regulatory molecules, activating or inhibiting the normal body process or the normal body physiology. So these are drugs or anything that may cause this. We are looking at it as a drug. Anything that you take within your body, okay, that may cause activation or inhibition, okay, any substance, okay, that is interacting with the body molecules or regulated molecules and it's causing activation and inhibition. We are looking at it, okay, as a drug, okay. And in pharmacology, we want to appreciate how this process is happening in affecting our normal physiology. Okay, so the simple definition of pharmacology is a study of drugs and medicine and how they interact with the body or the living system, okay, to affect the the normal process or the normal physiology. Okay, so how do they affect? By bringing about either activation or inhibition. Okay, so now with the definition of pharmacology appreciated, we went on to look at the branches of pharmacology. Branches of pharmacology, we have looked at pharmacokinetics and pharmacodynamics. When you talk of pharmaco, we are taking it from the word pharmacology. Okay, so there will be other lessons that we will look at how even this word pharmacology was coined and the likes. Okay, so for now, we're just concentrating on these parts and defining these words as they are. So when you talk of pharmaco, then kinetics to do with the movement. So we are saying the study of the effect of the body on the drugs. So the study of the effect of the body on the drug is a journey of about 4 steps. That is to do with absorption, distribution, metabolism, and excretion. That is ADME, ADME. Okay, that is the process. So now, the effect of the body on the drug, the body having effect on the drug, we are saying pharmacokinetics. So how does the body affect? There will be absorption, there will be distribution, metabolism, and the excretion of the drug. We want to appreciate this so that every drug that you take, it needs to come out of the body after it has done its work. Okay, but unfortunately, there are some drugs that when you take them, they will give you what we call side effects, or they'll give you adverse reaction. So when we want to appreciate the issue of side effect and adverse reaction, the other branch of pharmacology is pharmacodynamics. When we talk of pharmacodynamics, we are looking at the study of the effect of the drug on the body. Okay, so you take Piliton or chlorpheniramine, you feel drowsy. That is according to pharmacodynamics. So you're looking at the effect of the drug on the body. Because when you take this drug, it is causing you to feel drowsy. So that is pharmacodynamics. Apart from pharmacodynamics, okay, we went on to expand more notes on these and appreciated what they are. Of course, these they will be still looked at in detail in other lessons that we are going to cover, that is to do with pharmacokinetics and pharmacodynamics. Okay, then we look after defining pharmacology, looking at the branches of pharmacology, we went on to look at the routes of drug administration. So basically, the routes it's enteral, parenteral, inhalation, on others, and topical. What is important to note is that the routes of drug administration, okay, is important for the us to estimate the property of the drug. That is it water soluble, lipid solubility, or is it ionized? It is also important, okay, in determining the therapeutic objective, whether it is going to be achieved as we are giving this drug. Okay, because there are some drugs that can be destroyed by enzymes within the GIT. So we'll not give them through the GIT, we'll give using different routes. So certain drugs cannot be made so that they pass through a certain route because they may cause toxicity. So such things. we need to appreciate. So, in looking at enteral routes, we have looked at oral and sublingual. Oral, that is by mouth, then it goes in the stomach, GIT. And then when you say sublingual, you just put under the tongue. So it is important to appreciate because there are fewer drugs that are given sublingual so that you note them. In our discussion, we have given an example, the drug that is given sublingual. Most drugs are given by oral route of drug administration. So please, you can still look out for our other lesson where we will look at parenteral drug administration as a route of drug administration. So please, you have to keep studying and you have to enjoy your pharmacology because it constitutes one of the most important component in medicine. So thank you very much.